At 19 years, he never thought that one day his life would stand still, that the four walls of an isolated room will be his new home, and the doctors with protective suits will be his new normal.
Life in isolation, I can say, is bearable. The only challenge may be just staying indoors all throughout the day, but otherwise everything else is okay. The only distinctive symptom I had, and this was only once when I went to hospital, was fever, because it went as high as 39.1.
Before isolation, he had plenty of things to do. He made plans, just like everyone does, and he was busy. Now, the two books that he carried along with him keep him company as the days go by, awaiting for the more tests to be done, and he gets confirmed to be negative.
So we have doctors who pass around every evening. And they check our temperature and check on our progress.
What are they treating you for? Because, you know, there's no, like, an exact drug to treat corona.
So this varies based on the patient. Probably if a patient is experiencing severe conditions, then I think the doctors know what medicine will be appropriate for them.
He is alone most of the times, forcing him to make friends with another patient at Mbagathi who is on a similar mission to get well. They are not allowed to move around, but once in a while they catch up.
And how is your friend?
Yeah, he has made tremendous progress. He was actually sharing with me this morning. He's feeling okay and just waiting to go home.
He is yearning for that day when he will go back home. Although he speaks to his family daily to keep tabs, he can't compare it to seeing them face to face.
I have quite a few things to say to them. One is that they should keep calm, but that does not mean that they should not give this disease the seriousness it deserves. They also need to remember that their health is, first of all, their responsibility before it's a government responsibility. And finally, they should remain positive and hopeful and believe that this is just a passing cloud.
As the numbers of coronavirus cases keep on rising, it is hard to tell who has it from who does not. In order to contain the pandemic, ensure that you maintain the 1.5-meter distance rule, wash your hands and sanitize them often. Saada Hassan, KTN News, Nairobi.